So let's think then about the cardiac output response. Remember, cardiac output Q would appear to follow, as we saw in the previous schematic, a linear light response. Q represents oxygen delivery and is a fundamental part of our Fick principle. So again, to re-emphasize the point, oxygen consumption, VO2, is a product of cardiac output Q and the AVO2 difference. So, as the schematic previously showed us, the normal, so this is a healthy population response for cardiac output to increasing exercise intensity is that linear light response as we saw. The reason cardiac output goes up is primarily as a result of an ever-increasing heart rate. So remember that there are two variables that drive cardiac output. One is the volume of blood that can be ejected per beat of the heart stroke volume. The second is the heart rate. So the fact that we're pointing here that the primary variable that's driving cardiac output is heart rate, it suggests to us that the big limitation in terms of cardiac output rising is the stroke volume, because the heart rate seems to dominate, and that's a really important take-home message, that stroke volume is a key limiting factor in the cardiovascular response to exercise intensity. So here's some data from our lab at Anglia Ruskin, and this is some data we collected in a group of cyclists who were riding aerodynamic or non-aerodynamic positions on the cycle. The blue line represents them adopting an aerodynamic position, and the red line is the non-aerodynamic position. But don't need to necessarily worry about that per se. But here you can see, rather than presenting the data as percentages of VO2 max, we're presenting the data as absolute power outputs. And again, what you can see, the error bars are showing the variation within our group, but it's a uniform response under both conditions. Starts to level out towards the end of the test, but it's a pretty linear response, all the way up from about 100 to 275 watts, as we saw on the previous schematic. What is fascinating is that response is almost identical to the response that you'll see for the VO2. That VO2 shows this linear light response, and then towards the end of the test will start to level out. The rate of rise starts to decrease. Now, here we've got some data for moderately trained females and elite females. Now, this is a nice little data set from MedSci Sport and Exercise. So you've got your cardiac output on your y-axis, and you've got your percentage of VO2 max on the x-axis. And you can see that at rest they have fairly similar cardiac outputs of just over 5 litres per minute, which is pretty standard. But in our moderately trained females, they're only achieving a VO2 max, a cardiac output of about 15 litres per minute. But you can see quite noticeably in our elite female athletes, they get into a cardiac output of just under 25 litres per minute. And in fact, even in elite males, we see cardiac outputs of no more than probably 40 litres per minute. But it's worth bearing that in mind. That's 40 litres of blood per minute through an object that is no bigger than my fist. So it shows you the key factor. That the key factor is the volume of blood that can be ejected per beat of the heart. Because the heart rate is going to show a fairly uniform response to exercise. Coupled with that, notice that in both groups, that if you move into the exercise conditions from 40 to 100%, the response to cardiac output is linear. Okay, so it's a linear light response. You've got linear increase in exercise intensity, you get a linear increase in the cardiac output. Of that cardiac output, though, it's worth considering where it goes. So where is this blood that is being driven through the cardiac output actually going? Now, this is quite interesting. This is under exercise conditions. This is cycling exercise, and what you can see is that the vast majority under these conditions, about 77%, goes to the exercising limbs. Well, that makes sense. That's where the majority of the work under this exercising condition, cycling, would go to. So it's about 20.3 litres in this case goes there. But what is fascinating actually is if you look at the second largest proportion, between anywhere 14 to 16%, goes to the respiratory membrane. Actually goes to the lung, and in fact what it goes to is to the diaphragm. And so this suggests to us two things. One, that there may well be a change in blood flow distribution during exercise, and secondly, it also informs us how significant the respiratory system is in terms of the supply of oxygen to meet demand. And so, although the lungs themselves don't actually fatigue, there is potential for fatigue within the diaphragm. But the way we prevent that is through this idea of blood flow redistribution. And we'll deal with that later on within this session, but it's worth bearing in mind that although we're seeing, as an example, something like a 5-fold increase in cardiac output during exercise, the delivery of that cardiac output, or where that cardiac output goes to, is not the same at rest as it is during exercise. And indeed, what we see is that cardiac output is shunted to where it is required. So although the amount of blood that's going to be directed increases, we direct it away from certain regions and direct it to other regions. So it's clearly demanded in the legs, but we're going to have to realise that less will go, for example, to the liver or to the pancreas or to the kidney. We still have to maintain blood flow to the brain, because the brain is only really working on oxygen and glucose. But quite clearly, a large proportion is now being directed to the respiratory membrane.